Hi, I'm Joy, the physical therapist, and I'm here with iClimb to talk about solutions for issues that I see in a lot of folks with Parkinson's disease. So today we're going to talk about lower back pain, specifically the type of pain that starts in the lower back and then travels down the leg. So I'm sure a lot of you all have experienced this or know someone that has experienced this. There's a lot of names out there for it. In the medical community, we call this lumbar radiculopathy. That's a really fancy term, right? For pain that shoots down your leg essentially, but that's coming from your spine. A lot of folks will refer to this as sciatica. That's sort of a large term that often means this sort of same thing. If I hear someone talking about it. So if you have someone that says, oh, my sciatic nerve is acting up again, you know, that's often how it comes across. So it's truly not the sciatic nerve. However, sciatica is this term that you'll see a lot, and it's describing the same thing, this lumbosacral radiculopathy or lumbar radiculopathy, which again is our fancy term for leg pain shooting down the leg coming from the spine. So why do I see this happen in my folks with Parkinson's? So I think this is stemming a lot from these postural changes that we see in the spine and the back. We get this forward positioning from lack of that sensory response in the body. The body doesn't know where it is in space. So I talk about this a lot with my patients and folks I've worked with in the past. The body doesn't know that it's forward as much when you have Parkinson's, and so correcting that can be harder. So what we see is a lot of side effects from that prolonged posture being forward, that forward slumped postural position. So one of the things that can happen in the spine is disc issues or nerve compression from all this forward positioning in the back. So often it's not the forward positioning in and of itself that causes the problem. It's often a combination of an activity combined with that poor posture. So I tell a lot of my patients, I tend to see this about 2 to 3 weeks after a big snow. Do you know why? It's because someone that's not been shoveling a driveway for a year goes out and shovels a driveway. And that forward bend with the rotation and loading of the spine can cause that nerve to get compressed, can cause a disc bulge or protrusion. We see it all the time. So watch yourself on that first snow. Keep your body in good alignment and give yourself breaks, because I see it all the time, okay? So that being said, it doesn't have to be a snow shovel that causes it. Sometimes it's as simple as bending down to pick up a water bottle. So it may be something really small. I say the water bottle because it just happened 2 weeks ago. I'm not lying, I made that one up. I didn't make that one up, that was from a patient, okay? Legit, bent down to pick up a water bottle and pain down the leg. Okay, so it can happen. Now it doesn't have to happen, but oftentimes it happens because of a combination of poor posture and positioning and some sort of repeated movement pattern or a movement pattern that person is not used to doing. So the best thing we can do is to keep you strong and in good condition to help prevent things like that. So that is why you're here, right? And I'm here to talk to you a little bit about how to fix this issue if it comes up. So with that nerve root getting compressed, oftentimes, more often than not, it happens with a forward position, forward bending, sitting in a chair for too long, because that all creates the same positioning on the spine, okay? So forward posture, bending forward, sitting in a forward position. Do you see how that does the same thing to my spine in all directions there? So sitting up nice and tall, backward bending is the opposite direction, okay? So that's often what hurts when someone has a disc issue. So let's say this is what often happens. I bent down to pick up a box. I was moving things into the house, and all of a sudden I started having awful pain in my lower back, and it went all the way down my leg to my foot. That's what I'm talking about, okay? In these cases, it's often really painful to straighten the back up, even though that's what the spine really needs, okay? So helping to reposition the spine how it should be, as opposed to keeping it in a position where that nerve root is getting pinched. So some of the things that we do to help improve that alignment of the spine, get the pressure off that nerve, okay, is a series of exercises that I want to try with you today and see if you're able to do. Now, if you're in the middle of an episode like this, I'm going to show you how to deal with that. And if you're at the end and you have fairly good mobility and don't have a lot of residual symptoms, I'm going to show you how to deal with that too. So there's a progression of exercises that we use to help address these issues in the physical therapy world, and I'm going to share them with you as well. The whole goal of these exercises is what we call centralization, okay? So we have pain that goes down the leg, down to the foot. That means that nerve's getting compressed. We want that pain to come out of the leg and centralize in the lower back, okay? So I tell folks that the first goal is to get the pain out of the leg and to the side of the problem, as I like to say, okay? So being that the spine is often the culprit, and that's where the primary problem is, even if you feel pain down the leg, okay? So it doesn't mean there's something wrong with your leg, but oftentimes the nerve that supplies the leg actually starts up in your lower back, and that's most often where the problem is. So we first need to get that pain out of the leg, centralized in the lower back. And that usually doesn't happen in a day, but that's kind of a process of getting the pain to move all the way back up to the side of the problem, all right? So we're gonna work on that today, all right? Now, just like with all of our exercises and things that we talk about, if you're having issues that are, serious, certainly if you're post-surgery, this is maybe not something that you would be able to do. But if this is a minor issue, this may be a good place to start to try to reverse some of these symptoms. And often where I have people start, if they give me a call in a pinch and what have you. So the first thing is to get us, again, out of this forward position into an upright position. You're gonna see kind of a theme, I'm sure, with a lot of our videos and our trainers, because posture is so helpful. It improves the body's ability to function, to balance, to breathe, to get oxygen into your body. It's such a big help. So we're gonna start on the floor if you can, okay? If you can't, hang on, we'll get to some ones you can do, and I'll give you some modifications. So getting on the floor if you can, this is step one. If you're having a lot of pain going down your leg and you feel like you can't do much of anything, your first goal is to get flat on the floor, okay? And just lay. That is all you need to do, is just lay. And that may start with just a couple minutes, working your way up to 5 to 10 minutes, because what's that doing? It's getting your back out of that forward position and helping to realign your spine. Now, if you lay on your stomach and that pain in your leg goes away, that's a very good sign. That's a very good sign. And if you find you're able to tolerate that position for 5 to 10 minutes, the next step is just what I'm doing now. We call this prone on elbows. So propping up on the elbows. And you're gonna wanna keep that lower back relaxed, okay? I don't want you to tense up your lower back, let it stretch. All right, so you're gonna let it stretch. And again, the goal here being to just get a stretch to the lower back, realign the spine, and get you out of that forward position that's creating that nerve pressure. So if this is too much, you go back down, work your way back up again, and hold, okay? I like to work up to 2 to 3 minutes in this position. So hopefully this is getting a little bit easier. And honestly, if you don't have any back pain, this is still really good stretch for anybody, because the reality is people don't get on their stomachs and they don't get on the floor, and we lose this extensibility in the spine to be able to go backward, okay? And this is everybody, okay? So while these exercises are designed to help with the spine, they're really good to just getting the spine flexibility improved, okay? So anybody can benefit from this, a nice stretch in that lower back. So hopefully this helps some of the pain in the leg. Now, I tell folks, if you feel that the pain in your leg is better, but your lower back pain actually feels worse, That is not uncommon, but it's not dangerous, okay? So what's happening, we're getting the pressure off that nerve. That doesn't mean that nerve is not angry, okay? That nerve is still angry. And what you might find is you feel like you have more pain because your brain is now focused on a smaller area, okay, that's addressing. So it might feel worse, though it's not truly worse. We're getting decompressed, okay? So if you're not having leg pain, but the back feels worse, hang in there. Work on these for a few more days, and it should help to slowly get that back pain to go away as well, all right? So this is step 2. If you're having an episode of this lower back pain that shoots down your legs, this is step 2, getting up to prone on elbows. So if this is easy for you and getting easier, you can move to press-ups, okay? This tends to be a little bit harder, okay? The goal here being it's almost like a push-up, pressing up and down, getting that stretch into your lower back. The difference being now we're loading the spine, okay? Now you can notice gravity is in this direction and through my spine now, right? We're gonna do it a little bit heavier in a second, but this is step 3, being able to do a press up. Again, this is really good for anybody, okay? Really good for anybody. Feeling that stretch in your spine. Now, if this is painful, you go back to the prone on elbows, okay? But if this feels good and you're telling me, Joy, this is no big deal, I'll say, wait a minute, and I'll make it a little bit harder, okay? I joke with people that they only tell me something is too easy one time. Good. All right, so that's step 3, okay? Step 4, we're actually standing. So I'll give you a minute. All right, chair if you need it, knee if you don't. Give you a minute to stand. So, laying on the stomach, propped up on the elbows, press-ups, which you can do in sitting as well. You can modify and do kind of a press-up here and just kind of work on arching the spine. The last step, step 4, is standing. Now gravity is going straight through my spine, okay? You can use the arms at your lower back to give you some pressure if you like, and then we're just arching the back, okay? The main thing here being we're not bending the knees, okay? I see people do this. That's not a stretch in your back. That's a knee bend, okay? So see the difference there? I'm arching, stretching the spine, and then coming back up. Arching, coming back up. Arching and coming back up. I like 10 repetitions with this one, okay? Now, if this is helpful, so say that, let's see, I have an example. So I have a lot of folks that get this that work desk jobs, okay? So if you're sitting a lot during the day, I recommend they get up every hour if they can and do 10 back bends. So think about how much forward we do during the day. How much backward do you do? Not a lot, I'm guessing, because most of us don't. We need more backward, okay? We need this motion in our spine. If not, what direction do we head? And then it's really hard to get back, okay? But this throws your balance, okay? It affects your walking. It can affect how tight these muscles are in your legs, and then it can create more pressure across your lower back. So it's really important to get this back, this backward stretch, okay? But this is safe to do every hour if you need it, 10 repetitions. And I tell folks, I like minimum 3 times a day, but if you're gonna be sitting a lot, get up and do this. If the pain starts going back down your leg, get up and do your back bends. This tends to be easier to do if you're out and about during the day. So you're waiting to check out at the grocery store. Let's do some back bends, okay? Find a way to work it in your day, because this is really important for everyone, really, to do this range of motion, okay? So that's the progression of exercises to address that pain that can happen from disc movement and nerve compression, creating pain down the leg. So that can often be very, very helpful. And then I like to follow that with core strengthening, which I know you get a lot of at the Climb That's really important to keeping the back strong and stable, and again, keeping you conditioned. So if you do something that's not quite your normal, like shoveling that driveway, that you're not straining yourself to the point of pushing your body to the brink and creating sort of a cascade of events like this. So the goal being prevention when we can, and then rehabbing when we can't, and that's sort of where I come in a lot with my patients. So I hope that you find this helpful, and have a great day.